Have you ever felt like your body is sending you signals that you ignore, as if you were carrying a hidden time bomb inside you? Thousands of men in the United States and across Latin America go about their days without realizing the silent danger within them: prostate cancer. It's not something distant. It's not a problem for others. It could be very close to you, touching your life while you continue with your daily routine. Imagine a man like you, Michael, 55 years old, who works long hours, takes care of his family, and never thinks about getting a checkup. One day, he wakes up with some discomfort he ignores, and what seemed trivial could turn into a real threat. Prostate cancer is silent and treacherous. Often, it doesn't give signs until it is advanced, which is why it's called a kind of time bomb inside the male body. The statistics are clear and alarming. 1 in 8 men will develop prostate cancer at some point in their lives. This is not to scare you irrationally, but to open your eyes and make you aware that prevention and early detection can save your life. Think of it as if your body were sending you warning messages that you cannot ignore, small beeps that, if you listen to them in time, can prevent a catastrophe. The most important thing to understand is that detecting this cancer early completely changes the outlook. When caught in time, the survival rate reaches 98%. Almost all men who receive an early diagnosis manage to overcome it. It's like being able to catch the bomb before it explodes, before it causes irreversible damage. But the problem is that many men, especially in our culture, avoid going to the doctor. "I don't have time, I feel embarrassed, I feel fine," are excuses we hear over and over again. And then comes the moment when the symptoms are impossible to ignore, when the disease has already progressed and the treatment is more complicated, painful, and less effective. It is crucial to understand that it doesn't matter if you feel strong, active, and healthy. Prostate cancer does not discriminate. The risk increases with age, especially after 50, but it also depends on your family history, lifestyle, diet, and even genetic factors. It's like a storm forming quietly, and even if the sky seems clear, the signs of change are there, only many don't see them. That's why you need to pay attention to what your body is telling you, because these next few minutes could be the difference between early detection and a late diagnosis that changes your life and your family's life forever. Detecting prostate cancer in time can make the difference between life and death. When discovered in its early stages, the chances of overcoming it are nearly total. 98% of men who receive an early diagnosis manage to recover. Think about this. Almost all men who act in time are able to continue watching their children grow, enjoy moments with their grandchildren, and keep living without the shadow of a disease that can be deadly if ignored. It's like having an invisible shield protecting you, but that shield only works if you recognize the first signs and act quickly. However, many men ignore these signals out of fear, shame, or simply routine. It's common to hear, "I feel fine, I don't need to see a doctor," or "I'll get checked another day." What's not understood is that while you postpone the visit, the cancer could be growing silently, pressing on nerves, blood vessels, and tissues without causing pain. It's like a small crack at the base of a building being ignored. At first it seems insignificant, but over time it could cause a collapse. Detecting it in time not only saves lives, but also allows for less invasive treatments with better outcomes. For example, men who had routine checkups could avoid complex surgeries and long radiation therapies, instead receiving simpler interventions that didn't affect their quality of life. It's like fixing a pipe before it bursts. The work is easier and the consequences much smaller. Additionally, early diagnosis means less stress, less uncertainty, and more control over your own life. The key message here is clear. Your body is constantly talking to you, and early detection is your best weapon. It's not just about statistics, but about your day-to-day life, continuing to share moments with your family and feeling strong and active. Ignoring it doesn't make the risk disappear. It only lets it grow silently. So every time you feel some discomfort, even if it seems minor, don't ignore it. It's better to spend a few minutes on a checkup than risk years of health and well-being. Before we continue, I'd love to know something to connect with our community. Which city or country are you watching from? Write it in the comments. I enjoy getting to know the people who truly care about their health, and this allows me to create more useful and relevant content for you and your region. Let's get to the point. There are several factors that increase the risk of developing prostate cancer, and knowing them gives you the advantage of being able to prevent it or detect it in time. Age is the most obvious. After 50, the risk begins to rise significantly, and after 65, it skyrockets. Imagine a man named David, 58 years old, who always felt healthy and active. He thinks that being in shape will protect him. However, age alone already places him in a risk group. It's like walking on rocky terrain. Even if your shoes are good and you walk carefully, the stones are always there. Family history also plays a crucial role. If your father or brother has had prostate cancer, your risk doubles, and if there is a history of mutations in genes like BRCA1 or BRCA2, the risk rises even more. It's not just about genetics. It's a reminder that your body has specific signals you should watch for. Think of it as a treasure map. If you know where the dangers are, you can avoid them or face them before it's too late. Lifestyle and diet are also decisive. Being overweight or obese increases not only the probability of developing the disease, but also the chance of it being more aggressive or returning after treatment. Eating unhealthily, avoiding exercise, and maintaining sedentary habits are factors that fuel the silent storm within your body. That's why it's important to incorporate concrete changes into your daily routine, walking at least 30 minutes, reducing red meat consumption, increasing fruits and vegetables, and maintaining a stable weight. These are simple measures, but they have a huge impact on your prostate health. Finally, even though many men feel invincible, even those who appear healthy may be at risk if several of these factors combine. This is not alarmism, but awareness. Every risk factor is a signal to pay attention, to listen to your body, and to act before it's too late. Knowing these risks gives you power, the power to take care of your health, protect your family, and continue enjoying life with peace of mind. One of the first signs your body may show is frequent urination, especially waking up multiple times at night. This is known as nocturia, and although we sometimes think it's normal because of coffee or beer, there are differences that should not be ignored. Imagine James, a 52-year-old man, who always had his morning coffee and a light beer in the evening. Suddenly, he starts waking up every hour at night without having changed his habits. That difference is a clear message that something in his body is not functioning as it should. The scientific explanation is simple. The prostate surrounds the urethra, the small tube through which urine leaves the body. When the prostate grows, whether due to inflammation, benign enlargement, or a tumor, it presses on the urethra and the bladder never fully empties. It's like a river encountering an obstacle. The water accumulates and tries to flow more frequently. That's why you feel the constant urge to go to the bathroom, even if you've consumed the same amount of liquids as before. This constant pressure can interfere with your sleep, rest, and energy during the day. Additionally, nighttime frequency is key. Most adults can sleep between 6 and 8 hours without waking, but if you wake up 2, 3, or 4 times each night, that is not normal. It's not just a cup of tea before bed, it's a signal your body is sending. Keeping track of your bathroom visits can help identify patterns and provide precise information to the doctor, something that can speed up diagnosis. Even if it's not cancer, ignoring these symptoms can affect your quality of life and lead to complications. Think of it as your body's alarm. The sooner you hear it and act, the easier it will be to prevent bigger problems. Recognizing these signs gives you power over your health. It's neither weakness nor shame to see a doctor. Taking early action can mean the difference between a simple intervention and a disease that silently progresses to complicate your life. Another symptom many men prefer to ignore is pain during ejaculation. It's a delicate and embarrassing topic for many, but it's a signal that cannot be overlooked. Imagine Carlos, 57 years old, who every time he is with his partner feels a sharp pain in the testicles or deep discomfort in the rectal area and lower abdomen. Sometimes it lasts only seconds, other times it persists for hours, affecting his intimate and emotional life. This pain is like a silent alarm. Your body is telling you that something inside isn't working correctly. Scientifically, pain during ejaculation can be caused by inflammation of the prostate or the presence of a tumor pressing on nearby nerves. It's like the electrical wiring in your house being damaged. the signals don't flow correctly, and the malfunction shows up as pain. Even younger men can feel discomfort if they have been sexually inactive, but if you are an older man and this happens frequently, it's not something that will go away on its own or just with painkillers. Ignoring this symptom can affect more than your physical health. It also impacts your self-esteem, relationships, and emotional well-being. Many men avoid discussing it even with their partners, but communicating what you feel can be key to receiving support and acting in time. A practical approach is to note when the pain occurs, its intensity and duration, and share this information with the doctor. This facilitates a faster and more accurate diagnosis. Remember, not every case means cancer, but every time the pain repeats or intensifies, it's a signal to act. Think of it as a red light on your dashboard. You can ignore it, but the longer you do, the higher the risk of a bigger problem. Listening to your body and seeking medical attention on time can save your quality of life and prevent complications that affect your intimacy and daily routine. A symptom you should never ignore is the presence of blood in the urine or semen, medically known as hematuria and hematospermia. Imagine Robert, 60 years old, who one day notices a slight pink tint in his urine. At first, he thinks it's from something he ate or a drink, but his body is sending a clear alert. Something isn't right. Blood in places where it normally shouldn't be is always a sign of concern and should never be overlooked. The scientific explanation is simple. When a tumor grows in the prostate, it can press on nearby blood vessels, causing them to rupture and letting blood appear in the urine or semen. Sometimes the amount is obvious, other times barely noticeable, but the signal is still important. It's like seeing a small water leak in a pipe. Even if it seems minor, it indicates internal pressure that could worsen if not addressed in time. It doesn't always mean cancer. Urinary infections, kidney stones, or inflammation can also cause bleeding. However, only a doctor can determine the exact cause. Ignoring this sign is risky because if it's cancer, the tumor will continue growing and become more difficult to treat over time. Keeping a record of when the blood appeared and any other related symptoms can be vital for early and accurate diagnosis. Beyond the physical aspect, this symptom can generate fear and anxiety. The key is not to let worry paralyze action. Remember, every sign your body gives you is an opportunity to intervene on time, as if you had a map guiding you toward prevention and early detection. Acting quickly can mean the difference between a simple treatment and an advanced disease that affects your quality of life and that of your family. Another important symptom you cannot ignore is pain while sitting. Imagine Robert, 62 years old, who while working at his computer, driving, or simply watching TV, feels a dull pain in the perineum, right between the testicles and the anus, or in the lower back. It's not normal muscular pain from exertion or poor posture. It's constant and does not go away even if you change positions or take painkillers. This pain is like an internal alarm indicating that something is pressing on the nerves and muscles near the prostate. Science explains that when the prostate is inflamed or has a tumor, it exerts pressure on everything around it: nerves, blood vessels, and muscles. This causes discomfort even at rest. Think of it as an object stuck in a water pipe. Even if the pressure isn't extreme, it causes an irregular and constant flow that doesn't go away on its own. Many men try to ignore it by changing positions, sitting sideways, or standing longer, but this only temporarily relieves discomfort without addressing the cause. This pain may seem minor at first, but over time it can interfere with your daily life, affecting concentration, rest, and emotional well-being. Listening to these signals is crucial. Some men dismiss it because they think it's normal with age, but the reality is your body is speaking and deserves to be heard. Ignoring these warnings can delay a diagnosis that could be key to successful treatment. Moreover, identifying and acting on this symptom early can significantly improve quality of life. A timely diagnosis allows for less invasive interventions and prevents serious complications. Remember, your body is like a clock marking the passage of time, and every signal it sends is a reminder to take care of yourself. Feeling pain while sitting is not just a minor annoyance. It's a clear message that you need medical attention before the situation worsens. When prostate cancer advances, it can spread to other parts of the body, and one of the most serious signs is deep pain in the back, hips, or chest. Imagine Robert, 65 years old, who begins to notice a constant pain in his spine and hips that doesn't go away with painkillers or rest. At first, he attributes it to age or lifting heavy objects at work, but in reality, it's a warning that cancer cells have reached the bones, their favorite place to settle and grow. This pain is not like temporary muscle soreness. It's deep, intense, and persistent, and usually worsens over time. Science explains that cancer cells travel through the bloodstream and lymphatic system to the bones. Once there, they start altering bone structure and press on nearby nerves, generating pain that doesn't respond to common remedies. It's like having a small sabotage at the foundation of a building. You can't see it from the outside, but it affects the entire internal structure. That's why pain that comes and goes, but becomes stronger each time, must be taken very seriously. This symptom is particularly dangerous because it often coincides with other existing signs, such as changes in urination, pain when sitting, or swelling in the legs. Ignoring it can complicate treatment because when cancer has already reached the bones, more intensive therapies like chemotherapy or radiation are needed, which affect your energy and quality of life. Detecting it early means being able to intervene before the damage becomes irreversible. Additionally, this deep pain can affect your mood, sleep, and emotional well-being. Living in fear or ignoring this signal only increases stress and fatigue. Listening to your body and going to the doctor on time is an act of responsibility toward yourself and your family. Every day that passes without attention is a lost opportunity for a less aggressive and more effective treatment. Think of your body as a system sending you alerts. If you listen and act, you can regain control and protect your future, avoiding serious complications and preserving your quality of life. Swelling in the legs or feet is another sign you cannot ignore. Imagine Daniel, 63 years old, who begins to notice his shoes feel tight, pressing on the skin leaves a mark, and one leg looks more swollen than the other. At first, he thinks it's from standing too long or heat, but when this swelling doesn't go away, day or night, it's a warning message. In some cases, this sign indicates that prostate cancer has affected the lymphatic system, blocking the natural drainage of fluids in your body. The lymphatic system is like a network of pipes that carries fluids and fights infections. When cancer cells invade it, those pipes become blocked and fluid accumulates in the legs and feet, causing persistent swelling. It's like a garden hose getting clogged. The water stays pooled, creating constant pressure. This swelling is not temporary or minor. It can affect your mobility and daily comfort, making it difficult to walk normally or enjoy your usual activities. It doesn't always mean cancer. Heart, circulation, or kidney problems can also cause swelling. However, if the swelling persists and is accompanied by other symptoms like pain when sitting, changes in urination, or fatigue, it's a sign you cannot ignore. Keeping a daily record of the size and intensity of the swelling can help your doctor identify the cause faster and take effective action. Furthermore, this symptom has a significant emotional impact. The feeling of heaviness and the change in the appearance of your legs can affect your mood and confidence. Recognizing swelling as an early warning gives you power over your health. It's not about unnecessary alarm, but about acting before the problem worsens. Listening to your body, seeing a doctor, and undergoing the necessary tests can prevent serious complications and maintain your quality of life, allowing you to continue enjoying your activities and family without limitations. Unexplained weight loss is another sign you cannot ignore. Imagine Victor, 61 years old, who starts noticing that his clothes are looser and that friends and family ask if he is sick. Even though he hasn't changed his diet or increased physical activity, the weight continues to drop. This symptom is concerning because it indicates that cancer is affecting your entire metabolism. Cancer cells act like pirates inside the body, stealing nutrients and energy, gradually weakening your body. We're not talking about losing just a few pounds. This is noticeable weight loss that alters your appearance and energy. Along with this, extreme fatigue can appear, both physical and mental. Getting out of bed in the morning becomes an effort, and going to sleep doesn't bring relief. It's as if your body is draining all your strength while trying to continue functioning normally. This widespread exhaustion reflects that cancer is already causing systemic damage, affecting organs, muscles, and systems that previously functioned properly. Ignoring these signs can delay diagnosis and complicate treatment. It's essential to pay attention to any sudden or unexplained weight loss, especially if accompanied by constant fatigue, pain, or changes in urination. Keeping a daily record of your weight and how you feel can be vital for providing clear information to the doctor and facilitating early diagnosis. Additionally, this symptom has a strong psychological impact. Loss of energy and strength can cause anxiety, sadness, and feelings of helplessness. Acting quickly by consulting a specialist and undergoing necessary tests not only protects your physical health, but also your emotional well-being. Listening to your body and taking timely action is an act of responsibility toward yourself and your family. Detecting this sign early can mean the difference between a simple treatment and advanced disease that compromises your life and quality of life. Numbness and weakness in the arms or legs are critical warning signs that cannot be ignored. Imagine George, 66 years old, who starts feeling tingling in his legs, difficulty walking, and a numbness that slowly spreads. He might even experience electric shocks running through his limbs. These symptoms indicate that cancer has reached the spine and is pressing on the spinal cord, becoming a serious neurological problem beyond the prostate. Science explains that the spinal cord is like the main wiring in a house. Any pressure or damage interrupts communication between the brain and the body. When cancer cells press on the spinal cord, nerve signals are blocked, causing weakness, tingling, or even loss of bladder and bowel control. Incontinence is not a minor problem. It's an alarm that nerves are compromised. Ignoring these symptoms can lead to permanent damage, and quick intervention is essential to avoid severe consequences. These types of signs demand immediate action. Unlike other symptoms, you cannot wait for your regular doctor's appointment. This is an emergency that requires urgent attention. The sooner the pressure on the spinal cord is relieved, the better the chances of preserving mobility and nerve function. Think of it as a blocked highway. The faster the obstruction is cleared, the sooner traffic returns to normal and serious accidents are avoided. Neurological symptoms also affect not just your body, but your independence and quality of life. Feeling weak or numb can cause fear and frustration. Listening to your body, recognizing these signals, and going immediately to the emergency room is an act of responsibility and self-care. It's not about exaggeration, but about protecting your life and well-being before the damage becomes irreversible. Detecting and treating these signs early can save your mobility, autonomy, and ultimately your life. Now that you know the 8 warning signs your body may be sending, it's time to take action. Remember, not all of them indicate cancer, but you cannot assume that it's nothing. Ignoring these alerts is like walking through a minefield without paying attention. Every misstep could have serious consequences. Imagine Mr. Alexander, 64 years old, who noticed he was getting up 3 times every night to use the bathroom and felt a dull pain when sitting. At first, he thought it was normal for his age, but he decided to see a doctor, and tests revealed early-stage prostate cancer. Today, after timely treatment, he remains active and enjoys time with his grandchildren. If he had waited, the outcome would have been very different. The first thing you should do is stay calm. Don't panic and make smart decisions. Schedule an appointment with a specialist as soon as possible and complete all recommended tests, from the PSA exam to a full physical evaluation. Think of these steps as tools that allow you to regain control of your life. Don't let embarrassment or fear delay care. Those few minutes of discomfort can save you years of pain and suffering. Take care of your lifestyle. Balanced nutrition, regular exercise, and maintaining a healthy weight are powerful allies. Increase your intake of fruits and vegetables, especially tomatoes rich in lycopene that protect the prostate and reduce red meat. Maintaining an active sex life is also beneficial. Studies show that frequent ejaculation may reduce the risk of prostate cancer. Every daily choice you make counts and can make a real difference for your health. Also, never underestimate the power of your family. Often, they're the ones who can motivate you to take action, accompany you to medical appointments, and remind you that your well-being matters. Think of your role as a father or grandfather. Every exam, every preventive care measure is an act of love for those who depend on you. Detecting the disease early not only protects your life, but also prevents unnecessary suffering for your loved ones. Finally, remember that prostate cancer is not a death sentence. When detected early, the chances of successful treatment are very high. Every signal your body sends is an opportunity to act, prevent complications, and take care of yourself and your family. Don't wait until severe pain or advanced symptoms appear. Get your exams, listen to your body, and make responsible decisions. Your life, health, and future depend on it. There are no excuses. Act today.